Let's identify the structures on your word list associated with the spinal cord. So what we're looking at here with this model is a cross section through the vertebral column at the cervical spine level. We know that because this is a vertebrae, and some of your cervical vertebrae are what are known as bifid, which has two processes at the end of the spinous process. We also know that because we see the transverse foramen here, allowing the vertebral artery to pass through. The spinal cord is going to be this large organ here running through the vertebral canal. So we can identify the spinal cord. The subarachnoid space is going to be a space that sits just outside of the immediate spinal cord. So my probe is within the subarachnoid space. It is within this space that we have fluid called cerebrospinal fluid, and that fluid is got a couple of different functions, one of which is to protect both the spinal cord and the brain, because that fluid lies in the subarachnoid space around both the brain and the spinal cord. The next structure to identify is the epidural space. This space here is the epidural space. It is called epi because it sits above the dura mater, and the dura mater is this connective tissue structure right here. So this would be the epidural space. The epidural space is important because when anesthesia is given, sometimes in an effort to desensitize pain at certain levels of your spinal cord, anesthesia or an anesthetic can be injected into the epidural space, which will effectively reduce pain signals being sent into the spinal cord at that level. Next structure to identify is the central canal, and the central canal is right at the central part of the spinal cord. There is an opening through which some cerebrospinal fluid is going to flow, as well as sit in the subarachnoid space, and that is the central canal. The white matter, so when we take a look at the spinal cord, we can see that there is this darker colored tissue that almost has a butterfly shape appearance, and around that dark tissue is lighter colored tissue. All of this lighter colored tissue is white matter. A few different areas that are part of this white matter that you should learn. The first one is the lateral white column. So when we're orienting ourselves with this model, we know that spinous processes on vertebrae are posterior. So this is the posterior part of the model. This is the anterior part of the model. This is the vertebral body. So our lateral white column, if this is all white matter, is going to be the lateral white tissue we see here, lateral white columns. The anterior white column, again, posterior, anterior. So the anterior white column here, the posterior white column back here. So again, lateral white columns, anterior white columns, posterior white columns. The white commissure, I'm going to show a different model to demonstrate the white commissure. This model is still a model of the spinal cord. We don't see the vertebrae surrounding it, but we just see the spinal cord as well as some roots, which we'll talk about shortly. I want to show this model because the white commissure commissure means crossing, so this white matter here from one side of the spinal cord is able to cross over to the other side of the spinal cord. So this would be a white commissure here. If we take a look at the model, the white commissure would be this white tissue right here that connects one side of the cord and the other side of the cord. We don't see that white commissure very well on this model, so I've elected to show you the other model. If we were going to point out the white commissure on this model, I would say it would be kind of this white tissue here, right near that central canal that allows for white tissue to cross from one side of the cord to the opposite side. Gray matter. So again, the darker colored tissue is gray matter. The dorsal horn of the gray matter, so again, dorsal or posterior means toward the back of the body. We know this is the dorsal, the posterior part of the model. These are dorsal horns. The ventral horn of the gray matter would be the ventral, or the most anterior part of the gray matter. So here we see our ventral horns. The lateral horn of the gray matter, again, we're going to come out here to the lateral aspect of the gray matter. These are lateral horns. So again, dorsal horn, ventral horn, lateral horn. Dorsal, ventral, lateral horn. The gray commissure, so again, commissure means crossing. So this gray matter tissue that crosses from one side of the cord to the other is our gray commissure. The dorsal root of the spinal cord. If we take a look at this model, and I'll tip it up so we can see it a little bit better, we can see that they're coming out of the back of the spinal cord are these yellow fibers. This is the dorsal root of the spinal cord. The dorsal root ganglion, if we were to follow these yellow fibers away from the cord, there is this large bulbous structure, and that is known as the dorsal root ganglion. So again, dorsal root ganglion. The ventral root of the spinal cord, so if this is the dorsal root back here, the ventral root would be attached to the ventral part of the cord. So this is the ventral root. Anterior median fissure and the posterior median sulcus. So the cord is pinched at its anterior region, and the area that separates the cord into two sides anteriorly is the anterior median fissure, and the posterior median sulcus is this slight depression back here. Spinal nerve. So the spinal nerve is going to be created when the dorsal roots and the ventral roots merge together. So again, these are our dorsal roots, these are our ventral roots, and as they extend away from the spinal cord, these fibers, these neural fibers, are going to merge in this location, and this is what is known as the spinal nerve. So this would be the spinal nerve on the right, this would be the spinal nerve on the left. We demonstrate this dorsal and ventral roots, the dorsal root ganglion and the spinal nerve on this model. So again, we know that this is the dorsal part of this model and this is the ventral part, and the reason we know that is because this is the dorsal root ganglion. So this large bulbous structure is always going to be attached to the dorsal roots. So these are our dorsal roots here, these are our dorsal roots. These are our ventral roots here, and these neural fibers, you can see them colored red and black anteriorly and green and yellow posteriorly. When those fibers come together, this is our spinal nerve. Let me point out the meninges. So the dura mater, the arachnoid mater, and the pia mater. So remember we saw that epidural space. This is that epidural space, and the dura mater is a superficial connective tissue layer that helps to protect the spinal cord and the brain. So this is the dura mater. The arachnoid mater is connected to the dura mater, just deep to it. So here I'm pointing to the arachnoid mater. If my hands were those two pieces of those two meningeal layers, this layer would be the dura mater, and this layer would be the arachnoid mater, so they're kind of stuck together there. Just deep to the arachnoid mater is our subarachnoid space, which my probe is going into. And then finally, the pia mater is this connective tissue layer that is attached very tightly to the outer tissue of the spinal cord. So again, this is the pia mater. We can see if I tip the model here, this is the pia mater. Just superficial to the pia mater is the arachnoid mater, and then superficial to the arachnoid mater is our dura mater.